Welcome to our new episode of Psychoanalysis and Exploration. The topic for today is junction. Psychoanalysis is an area in evolution with pluralism of schools and beliefs. Often, this pluralism leads us to a situation where at a given point, multiple insights and interventions present themselves. And it is not easy to navigate such situations. Thus, we discuss this state of affairs with our subject expert, psychoanalysis consultant, Mr. Himanshu Vaidya. Namaste.
Namaste.
Sir, so can we start with defining junction points?
The word junction usually comes from railway junction. And the analogy is very educative. There are two characteristics of a railway junction. You can come from multiple directions to the same station, and you can go out from the same station in multiple directions. That is the definition of a railway junction. We encounter a similar situation in psychoanalysis almost after every few steps. Take, for example, the phenomena of depression. You can come to the same state of depression from multiple directions. One person can develop depression because he loses his business. Another person develops depression because he has lost somebody very dear to him. The third person gets into depression because he is very angry at somebody but is not able to express himself. The fourth person gets into depression because he has had repeated failures in life, and now the disappointment is total. It has led to hopelessness and resignation. Now, from all these various directions, you arrive at the same point of depression and you show very similar symptoms. Low energy, withdrawal from people, withdrawal from activities, not finding meaning in life, not finding anything pleasurable. So you can arrive at the same difficulty from multiple points, multiple directions. Similarly, what do you do to heal it? If a person with depression comes to you in psychotherapy, somebody will treat him with a Freudian approach. Somebody will treat him with a Kleinian approach. So from depression, how do you move out of it? That also has multiple directions. Based upon which school you are trained in, you will apply that school to heal that person. So you come to the same point of depression from multiple directions, and you can go out of the state into multiple directions and move on towards healing. So then this difficulty of depression becomes a junction point.
Right.
So every pathology that we know of in DSM, and even those outside of DSM, are essentially junction points from a psychoanalytic psychotherapy standpoint. For every disorder, we have at least 7 explanations from 7 different schools of psychoanalysis and 7 ways out of that situation given by each of these 7 schools. Or at least some people would even go to 11 schools. So every disorder becomes a junction point. That is one junction in the area of psychoanalysis, every disorder. Now there is a second junction of pathogenesis, that how have you reached where you have reached? Because multiple schools give multiple explanations. Similarly, how to do therapy. So there is a disorder is a junction. There are conceptual junctions of how one has reached here in terms of pathogenesis. And then there are therapy junctions, like what to do now, which route to take. And once you start therapy, first is the major therapy junction. Okay, do you want to go with Freudian therapy, Kleinian therapy, what route you take? And whatever route you take, on the way, there are junctions every 3 or 4 sessions. Like the session is going on and the client says something. So what do? Do you interpret or do you hold? If you follow the Gaussian approach, you will hold. If you follow the classical psychoanalytic approach, you will interpret. So this is a junction of technique that the therapy is on, and you reach a junction where multiple possibilities exist. And you have to choose one or a combination in sequence of some order, in intensity of some order. So there are technique junctions. So you have conceptual junctions. First is the disorder is a junction. Then you have conceptual junctions. And then you have applied junctions or technique junctions. And then you have multiple junctions coming on the route. So this is how the whole concept of junction becomes important in psychoanalysis, that in psychoanalysis, the core situation is we don't have one school, one pathogenesis, and one technique of therapy. We have multiple schools, multiple ways of understanding a single disorder, how it develops, and multiple ways of healing. And as the therapy proceeds, at any point of therapy, you can have a junction where different therapists trained in different schools will do a different intervention at the same point.
Right.
So the concept of junction is very important in psychoanalysis from a multiple pluralistic school point of view, from pathogenesis point of view, and from doing therapy technique point of view. So this is the whole concept of junction within psychoanalysis. And then when we go outside of psychoanalysis, say into CBT or holistic healing, new kinds of junctions emerge, which we'll discuss later. But for the moment, this is how we can introduce the concept of a junction in psychoanalysis, which is very important from both conceptual and technique point of view.
So as you said that even every diagnosis in DSM, every pathology in DSM is a some from different roots. It is a junction point, and thereon then again multiple junctions take over.
Right.
So what if you can explain us in a with some specific example for say psychosis, and how you would just explain this entire system of junctions,
right,
and the network? Good
one. Let me take an example of one example in the chapter on psychosis and schizophrenia. Say paranoia, delusion of persecution. Let's talk about schizophrenia, and we have delusion of persecution, paranoia. Now, the moment you say the difficulty is paranoia, as a disorder, it's a junction into itself. Because from multiple roots, you can root the same thing. If 100 people have paranoia, some will have it because of repressed sexuality. Some will have it because of attack of the bad breast. Some will have it because of attack of the beta elements. Some will have it because of inadequate mothering. Some will have it because of fragile self. And maybe a few more reasons that I don't know of or we are yet to discover. Or even the multiple reasons leading to same. Yeah, multiple reasons leading to same. Yeah. So what happens is that this disorder now becomes a junction, the first junction. That in terms of pathogenesis, how has the person reached here? So if you give it to a Freudian school, he will say it is because of repressed homosexuality. Right. If you give it to a Kleinian school, they will say it is because of the split being open and the unintegrated breast elements attacking back. If you give it to Cohusian, he will say it is the disintegration of a fragile self. If you give it to a Bionian, he will say it is return of the beta elements. So we are at a junction point. The moment pathology is present, a problem is presented to us, the pathogenesis itself becomes a junction activity, that you can reach the same difficulty from multiple points. Now, obviously, nobody of them is lying. Everyone has created his concepts from patients. So, which means that there are different groups of patients and each group has a different causality. Now, the patient before us belongs to which group is a question of great experience and judgment. So, first we need knowledge of multiple schools and then experience and judgment to figure out, okay, based upon the case history details, does he look more like a Freudian patient or a Kleinian patient? And we do a provisional judgment, and then as the therapy goes on, it becomes clear whether the provisional judgment is correct or needs a correction. So this becomes a junction point. Now, if you have, now what is the difficulty with this? Most people are trained only in one school. So if you go to any school that teaches psychoanalysis, a large number of them, almost 75%, I would say, they are very heavy in one school. And therefore, the person tries to force fit what he knows onto the patient. And that creates a difficulty because this is inefficient management of the junction. That you don't recognize a junction as a junction because you are trained only in one thing. So for you, there is only one highway, there is no junction. But the fact is, it's a junction. So when you are trained only in one school, the concept of junction does not occur to you. And then mistakes happen that somebody who is into paranoia because of homosexuality gets treated by a Kleinian who just puts aside the homosexual component and keeps focusing on the split. Or you can have the same thing in cohesion terms. That somebody with a homosexual dynamic can go to Kahoot and he would just keep on doing his own way of healing somebody. So this is where the unfortunate reality of half knowledge in psychoanalysis, which is more of the rule rather than the exception, that comes into play.
So when we're talking about different schools within psychoanalysis and how the person who's trained in multiple schools can actually identify with the junction and pick according to the need of the presentation and symptoms presented by the patient. At the same time, how does the therapy actually engages with these junctions?
So in the
therapy itself.
Yeah. So last question, we saw the junction phenomena in terms of pathogenesis.
Right.
And based upon the pathogenesis, adopting a particular style, a particular school for therapy. Now, as the therapy rolls on, what happens? Let us say a person with narcissistic personality disorder is on the couch. And he is expressing his grandiose fantasies about himself. Now, what does the therapist do? It is a junction. There are many approaches possible. What can be done?
Right.
You can just allow it to pass, which would be an ocean way of dealing with it. Or you can interpret. So just look at this junction. It's a very interesting junction. Classical psychoanalysis, which would include Freud, Klein, beyond, would essentially go into interpretation of grandiosity. That the therapist has to become the agent of reality and strengthen the ego of the person which is into reality and help the person overcome the fantasy of grandiosity. And they would say, not interpreting this would tantamount to siding with the pathology of the person and strengthening it.
Okay, the holding.
Yeah. The classical approach would be that you must interpret the grandiosity and be an agent of reality. You should take the wind out of the sails of the flight. And not doing so means you are on the side of pathology, you are strengthening the grandiosity. You are not strengthening the reality part of the patient. On the other hand, Kohut would say exactly the opposite. He would say that if you don't allow the person to live out his grandiosity, the grandiosity will never go away. It will get repressed. So interpretation actually pushes it deeper down into the unconscious. But if you allow it to be lived out in therapy without interpretation, after some time, the movement to reality naturally happens.
That means once the self is integrated enough to take the blow of reality, that is the time the interpretation can be done in certain.
So what Kohut would say is that narcissism is a natural developmental phase. That everyone is narcissistic at some point in time. Everyone is exhibitionistic at some point in time. If in early childhood you are allowed to live out this exhibitionism and narcissism with empathy and admiration and mirroring, after some time you are gratified, deeply speaking, and then a natural movement towards reality happens. But if you don't do the mirroring right, you are not empathic, you are critical, you are mocking it, you are attacking it in some way, you are dismissing, ignoring it in some way, then the movement gets arrested there. So narcissism, according to him, is an arrest of a developmental process. Now he would say, allow the process.
A beautiful statement.
Yeah. So allow the process to restart and undo the arrest, and unlock the arrest and allow the process to restart, and it will naturally move. But you will have to be very patient and you will have to be very holding. It will move naturally to realism. Now here you have the famous Kernberg-Kohut debate on this junction. And this happens many times in psychoanalysis, that on a junction point, there is a very intense debate between opposing experts. And
yeah, they're very contrary to each other.
Yeah, because these junctions are also that way very interesting. That on this point that we are talking about, Kernberg has a huge volume of work, how you must interpret. And Kohut has a huge volume of work, how you should not interpret.
Not interpret.
So it's a very interesting point. And it depends now upon you, okay, based upon the patient you have and the situation that is, do you go on the Kernberg's line or do you go on Kohut's line? Because both have done extensive work on narcissism with good results. So this is a very interesting junction point. Now, similarly, take another important junction point of a triangle between three different ways of doing therapy. The classical psychoanalytic way, the Freudian, Kleinian, Bionian way, one end of the triangle. Second end of the triangle, Kohutian way of doing it. And the third end of the triangle, ISTDP way of doing it. Now, technically speaking, all of them will fall broadly under psychoanalysis.
Gee.
But the way of doing therapy is very different at any given point of time. Take 2 points. Directing the session. Kohut and classical psychoanalysis, they have very sharp differences, like we just saw, between interpretation and holding. But on one point, they have great agreement, that is not directing the session. Not directing the session.
Okay.
That when the patient comes, you don't start the session. You allow the patient to start the session. You allow his unconscious to give direction to the session. And in the middle also, you don't bring something from your side which completely changes the direction of flow.
Again, there is no interpretation. It is just holding.
Usually you don't bring in facts, or you don't go on a line of discussion which sort of changes the course of flow of the unconscious of the patient. So let's say these 2 points. Okay? you don't start the session and you don't give direction to the session midway or any point of the session. You allow the unconscious of the person to start the session and give direction. Now, ISTDP is completely different than this. You start the session with a very particular question. What is the internal emotional problem I can help you with? It's a very standardized thing. You start the session. You don't allow the unconscious of the person to start the session. You start the session and you also give direction to the session. Because if the patient goes into talking anything intellectual, you stop it and bring him back to the affect. So at the risk of being rude, you are actually cutting short the patient many times.
True.
So it's a very different way of managing the same point. Let's say starting of the session, how do you manage it? It's a junction from a technique standpoint. How do you start the session? The classical way would be, and the Gaussian way would be to allow the patient to start. ISTDP way would be, no, you start with a standardized question. In the course of the session, if there is silence, what do you do? ISTDP will say, don't allow time to be wasted. Intervene and ask the person why he is silent. And see, point it out to the person how he goes silent when asked for affect. He's moving away from the affect into silence. In classical psychoanalysis and OHO both, there is a list of interpretations of silence. That what can silence mean? And usually you don't disturb that silence. Take the example of free association. Both OHO and classical psychoanalysis largely rely upon free association to know the unconscious. ISTDP largely believes that free association is used as a defense. So they do a very directed affect exploration. They don't get into free association because they believe that free association is used more as a defense rather than at the service of healing. So this becomes a junction point. That although largely speaking, all the three are in the domain of psychoanalysis, but they are very different from each other. And we are talking about a junction point doing psychoanalytic psychotherapy. We are not comparing psychoanalysis with CBT. Within psychoanalysis, we have so many of differences. That the doing therapy, it presents many points where at that point in the session, you can take multiple roads out. And that point becomes a junction. And if you take the transcript of the session to a supervisor trained in a Freudian school, he will say do X. If you go to the Kleinian school, he will say do Y. You take a clinician supervisor, he will say do Z. So these are the junctions that happen in therapy. And the first thing is to know what are the various possibilities at this junction. And that we can know if we know technique of multiple schools. That what would each school person do at this particular point. And then based upon our experience and judgment, we bring in some intervention.
So when we talk about firstly the pathology diagnosis junction, then we come to the therapy junction where different schools can be applied. Then that means there can be different points where there are problems a therapist is supposed to be picking up. So what is the solution to these problems of the junctions?
The solution is very simple and very difficult. The solution is, the solution is integrate all schools into one. So you have single pathogenesis and single technique.
Oh.
That is the solution. Now, that solution is a long-term solution. What is the medium-term solution? The medium-term solution is you can have a grid which talks about personality, pathology, intensity, and the best school to heal that person. That a given personality has depression, moderate in intensity, And given his personality and the case history, what would be the best way out? Should it be Freudian approach? Should it be Kleinian approach? What should it be? So that grid, that's a medium term goal. If people can get together and do that research to create a medium term. Now, this is what the goal states are, that the long term goal and the medium term. Now, what happens at present in practice and how do you achieve these goals? At present, what happens is the way schools train you, most schools, they expose you only to one or two schools, and that is what creates trouble. So we need somewhat more eclectic training in psychoanalytic institutes, and we need more schools represented in every institute. So psychoanalytic institutes need adequate number of 5 to 7 schools represented in some way. So they may be doing major in one, but they can offer minor in 5 or 4 to 5 different schools, so that there is some appreciation of others. So you may be expert in one, but at least you have appreciation of the others. It should not happen that the others, you have read only a few pages in the book. There has to be a full course, at least one full course on the 4 to 5 others. So that is one part. Now, from an intellectual standpoint, this integration can happen only if you get into integration at the level of model of the mind. Because the root of the whole trouble is model of the mind. Model of the mind will dictate how the mind operates, and one of the operations will be operations will lead to pathology.
Right.
And the road by which mind has entered into pathology will dictate how to heal that process. Because healing always will be a function of pathogenesis. If you believe the open split is leading to psychosis, you will try to close the split. If you believe that repressed homosexuality is leading to psychosis, you will try to enhance self-acceptance. If you believe that unhealthy self is disintegrating into psychosis, you will try to strengthen the self. So what you will do in therapy will be very different in all the three cases. So what you will do in therapy will depend upon how you see genesis of the problem. Because essentially in therapy, what you are doing is undoing the genesis. So it starts with model of the mind. If model of the mind can be such which can explain the phenomena which are elaborated by all schools of psychoanalysis, that kind of an elaborate, comprehensive model of the mind is what we need if we wish to resolve all these psychoanalytic junctions. Because every psychoanalytic junction is also a statement of our half knowledge. That it is a point of mystery, a point of confusion, a point where we have to heavily exercise our intellect. All of it because we don't have one integrated model of the mind, one integrated school, one integrated elaborate system of doing therapy. So the junction also is a statement of our half knowledge. So one component is to have an integrated model of the mind, and from there move towards explaining pathology taken up by different schools. And this is where the problem of psychoanalysis junction, meaning junction within psychoanalysis, can be resolved. Now it leads to a second problem of
other schools.
Yeah, other schools. It is like this is an intra-psychoanalysis junction. Then you have inter psychotherapy junctions. For example, we are talking about junction between Freud, Klein, Ohud, beyond ISTDP within psychoanalysis. Now, if you say CBT, so now if a person is talking something narcissistic, a CBT person would intervene very different. Very different from what Kernberg would do, very different from what Kohut would do. So then we have the inter-area junctions, which are even more difficult to resolve. And then when we go a step forward and we look at East and West, the entire Western psychotherapy on one hand, and the Eastern, primarily Hindu psychology on the other hand, which is a psychology fused synthetically with philosophy and spirituality, then that junction becomes even more difficult to resolve. And so this is actually in the area of psychotherapy, this whole arena is populated by various confederations, and how to bring all those confederations in one union. For that, you require a very holistic and integrated system, which can have a model of the mind, pathogenesis, and a healing technique, such that you can explain various possibilities that lead to the junction and move out of the junction. A grand synthesis, so to say, of the not only of psychoanalysis and CBT, but also between East and West.
East and West.
And obviously, this is not something easy to do. And
very rightly.
yeah.
So actually, yes.
Yeah. So I have attempted this in my heat system of healing. That how do you integrate various schools of psychoanalysis, and how do you integrate East with the West? So it's something that is a long-term project. I think in the next 50 years, this is not the prime intellectual projects to be done in the area of
very, very rightly put up, sir. Even in your own model, heat model, whether the therapist chooses to process the thought body or the behavioral body, if we see it that way also in the Western concept. So in nutshell, like this, there can be this very profound research and expertise which would be needed to create this holistic junction. So what would be this holistic junction like?
This holistic junction, because junction we talked about in various ways. Let's say this junction within the Freudian school, that there will be a, or let's say junction, let me say in the Bionian school, there's something called early Bion and late Bion. So for the same situation in therapy, early Bion would have done something different and the late Bion would have done something different. Early Bion would have used interpretation. The late Bion is into a unique kind of holding called getting into the state of the ineffable O. So there the healing moves from interpretation and ordinary holding into a containment and holding of a different kind, which leads to O. Now, this is an intra-school junction. Similarly, inter-school junction within psychoanalysis, Freudian and Bionian. Then we can have psychoanalytic and CBT. And then even more distant, let us say psychoanalysis, CBT on one hand, all the therapies, and homeopathy. All the therapies on one side and pranic healing. All the therapies on one side and Eastern approaches. So this is how the junctions arise, that the canvas of healing widens as you bring in more and more school, more and more opinions, more and more views on the constitution of the mind, the functioning of the mind, pathogenesis, and healing. So in the whole, if you put together everything, we are looking at a holistic healing canvas. And from smaller junctions, we move to bigger junctions. And the more junctions we resolve, more integration happens in the area of psychotherapy.
So what are the constraints? Like, what are the why are the junctions not being resolved for so long?
Should we take up that question, or in the second part? Says 2 minutes to go.
We can continue in the part 2 of the same episode, Junction.